Hi, I'm Robert Hossey. You're watching the Secrets of Deep Tissue Technique DVD that accompanies the course Secrets of Deep Tissue. Since you've already taken the class, you have the lecture that accompanies these techniques, and that's great. If you've not taken the class and you're watching this, please do not attempt these at home or in the office without further education. There's contraindications you need to watch out for, and that needs to be included before you attempt these techniques. Otherwise, enjoy and keep watching. Thanks so much. I'll see you soon. When treating golfer's elbow, we're going to stand with our client right in front of you, have their arm held up at 90 degrees. On the medial epicondyle, we're going to put some pressure with our thumb downward towards their point of their elbow here, and put some pressure downward and have them just open their arm up, and they're going to feel that. You can start the technique if they do have some acute injury going on, some cross fiber friction very aggressively for about 30 seconds, follow with pressure going again down towards the olecranon, put pressure in, and open that back up. You also can do it actively, where you put thumb over thumb, put pressure, and have them open that back up for you. Open that up, great, come back up again. Again, you always follow with cross fiber friction, put the pressure on, drop it down, and have them open that arm back up again. You want to wrap that up with ice when you're finished. When treating tennis elbow, have your client stand right in front of you, arm at 90 degrees, and we're going to put pressure just over the top onto the lateral epicondyle area. We're going to rub that, and it sounds simple, but where it hurts is where you're going to rub. So you're going to put your hand right across, cross fiber friction on the area of tenderness. Have your arm at 90 degrees, put pressure on that, putting pressure down towards the point of the elbow, and have them open that arm back up for you. If you need to reinforce that, again, thumb over thumb or fingers over fingers, just re-support that, reinforce, and have them open that back up. To treat carpal tunnel, start with your client with their palm up, and we're going to do some pin and stretch work. So we can start by bringing our client's fingers straight up, put pressure on the flexor compartment, and have them drop that down. Make sure you keep the fingertips straight. Come back up, make it active, put thumb over thumb, have them drop that down. Keeping fingertips straight, come back up again, put it somewhere else, drop it back down. Come back up, somewhere else, drop it back down. Work up and down for about 30 seconds on the flexor compartment. Then have your client turn their hand over, make a gentle fist, bring it up like you're revving a motorcycle. Put pressure on the extensor group, thumb over thumb, have them drop that back down. Come back up, put pressure, have them drop it back down, release the pressure, back up, making sure they keep a nice tight fist, drop it back down, come back up again, and work that for about 30 seconds. And the speed you want to work at is about this, pin and stretch, working up and down, back and forth. Next, we're going to take and we're going to do some cross fiber friction. So imagine they have a temporary tattoo right here at the wrinkles of the wrist, and you want to rub that tattoo off. So you want to work above and below, inch above, inch below. We're going to do cross fiber friction, grind that off, and this will hurt. If they have carpal tunnel, it's not going to feel good. We're going to cross fiber friction this aggressively for 30 seconds. Next, we're going to do some movement of these bones. Now, these bones are like dice. They're a gliding joint. We're not adjusting the joint, but we're simply making it go through its range of motion. So we're going to have them just dangle that wrist on our fingers. We're going to grip that wrist, keeping our thumbs parallel. And like a Rubik's Cube, we're going to rock that wrist like a Rubik's Cube. So grip it, rock, rock, rock 3 times. Grip the bones and just roll through a range of motion. You should feel a crunch or grinding noise. Once you do, you're done. Try it up to 3 times. After 3 times, don't keep trying. We'll address it the next time. But again, you'll grip it, rock, 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 pinch the joint, and roll. And you'll want to wrap that with an ice bag when you're finished. On the Quervain's tenosynovitis, what you're going to want to do is have your client put their thumb inside, wrap their fingers around that thumb, and this is a Finkelstein maneuver. And she drops that down, that's testing, but we're just going to go ahead and do the same test as part of the treatment. So we're going to put our thumb on top, do some cross fiber friction, and drop that down. Again, have her come back up, cross fiber gently on top of that sheath. And we're going to pinch it and roll back down. This is some gliding strokes down the tendon and open that back up. And when you're done, just again, wrap it with ice. For our seated routine, we're going to start off with putting our heel of our hand on top of the neck here, the lateral side of the neck, working down trapezius, and just have her drop her right ear to her right shoulder and glide downwardly. Come back up, we'll do the left side. She'll drop her left ear to her left shoulder. Come back up, alternate. And you want to make sure you're gliding while she's moving. And again, no oil whatsoever. Nice stretch. This next, we're going to go ahead and do a duck-billed pinch, nice and flat fingertips. Don't curl your tips of your fingers, but we're going to broadly pinch the left. She's going to turn her head right. Pinch the right, she'll turn left. Left, she'll turn right. If she feels a shooting pain up into her ear, that might be a sign there's a problem with the scaling muscle. Don't worry about that. We'll address that later. But again, nice broad pinch, and she'll turn her head the opposite direction each time. This next is a posterior pinch. Put her hand on her forehead, pinch the posterior neck, just pinch. Have her drop her head forward, come back up. This is passive. Pinch, she'll drop. Again, pinch. Keep moving around from place to place in the back of the neck. This next is a rhomboid glide with a torso twist. So we're going to have stand alongside the stool, put your knee into the hip so she doesn't spin. Put her hand on top of her shoulder. We're going to reach across and grab that elbow. Put the heel of our hand in the opposite rhomboid. Glide outwardly towards the scapula as you turn the torso. This next is an active release technique, but we'll start off with doing some cross fiber friction right where the levator scapula. Insert into the scapula, grind that, prepare it for some release. Put your thumb into the levator scapula's insertion. She's going to lift her shoulder towards her ear. And come back down. We'll put pressure again, resist that movement some. Come back up. You might want to put thumb over thumb. Back up, release, come back up again. You can play with that. You might want to use the heel of your hand to resist. If they're a larger person, you're smaller, you might want to put your elbow on that, have her lift back up. Again, don't stop them from moving, just inhibit that movement somewhat. Next, we're going to have her drop her head back into our cupped hand, and we're just going to support the occiput with our hand. We're just going to massage along the occipital ridge. And if it's already acute, you won't want to warm that up first, but you do want to get the area to loosen up some. After you've warmed the area up and you've felt for some trigger points, we're going to go ahead and put our hand on the lateral occipital ridge. And we're going to hold her forehead, put our thumb into the occipital ridge, we're going to lock it, and we're going to pin and roll the neck. Don't just shove the head forward, we're just going to roll that neck like a swan. Lock it and roll it. Come back to the more medial, lock it and roll. When you get to the center, we'll switch thumbs. So left thumb, left side, right thumb, right side. And work your way all the way across the occipital ridge. Next is a 360 pin stretch. So everywhere in the neck, we're going to put pressure. Her head's going to go in the opposite direction. So if I put pressure on the lateral neck, let's say on the left side here, she'll drop her right ear to her right shoulder. If we come more posterior, put pressure here, she's going to go more in the opposite direction that way. Each time you put pressure, her head will go away from that pressure for a pin stretch. When you're working more anterior, though, on the front of the neck, make sure your fingertips are flat, nice and flat pressure, so when she pulls back, you don't cause any more injury. Just gentle, gentle pressure with the flat of your fingers and the finger pads. And she can do this very passively, put pressure, and she'll move it herself when she understands which direction to go, working away from that. Short rectus abdominis, we're going to have our client with her feet on the table, knees bent. She's going to locate her pubic bone so you know where that's at. So put her hand back down. We're going to take our hands like this, hand over hand. We're going to work and drop up under the rectus abdominis muscle, up under the pubic bone. Keep that tension as we draw it tight. So take a nice deep abdominal breath to stretch it, and you'll see how this works. So again, I put my hands together. She takes a nice deep breath for me. When she exhales, I drop up under that bone. I'm lengthening the muscle. I hold that pressure. She takes a nice deep breath again, stretch, stretch, stretch. I release the pressure and give them a free breath. You want to make sure they have at least a free breath and not two inhibited breaths side by side, because if the person has any kind of restriction too much, it can cause some fight or flight anxiety. So again, nice deep breath. When she exhales, I'll drop up under, hold that pressure, nice deep breath again for a stretch, and release the pressure as she exhales. This next portion will have our client bring her legs back down flat, and we're going to want to have our hands with vertical fingers, just like this. We're going to hook the top of the pubic bone, draw down on that, draw down on the pressure, nice and firm with cross fiber friction. at that insertion onto the bone. It's not comfortable. Don't go too fast, but it's very firm and working that tendinous connection to help release the muscle from that standpoint. We'll also go into a stretch on the upper fibers and work laterally on both sides of where rectus abdominis comes up onto the rib cage. Nice deep breath. When she exhales, we'll take our thumbs with thumbprints directly up under the rib cage. Hold that pressure. Nice deep breath. We'll stretch it, resist, and exhale. It's pretty intense, so go nice and slow. Again, nice deep breath. When she exhales, follow that directly up and under towards her head. Hold that pressure. Nice deep breath. Resist, 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 and let her exhale. With knees back up, I'm going to go ahead and take, and we're going to grab the edges of rectus abdominis. I'm not squishing the muscle. I'm grabbing the edges, and we're going to take our fingers and rake the edge and pull it towards ourselves, and then with the horizontal heel of my hand and horizontal thumb, we're going to push again. So it's basically a push and pull, perpendicular pressure on rectus abdominis. So I'll go ahead and outline that right in the center. I'm just going to go ahead and pull that edge towards myself. And she can breathe normally. I'm going to hold that, and then I'll push away from myself here, holding that pressure. And then pull towards myself. And I'll hold it between 4 and even 10 seconds, but just be patient. And as I do this, it helps release trigger points that might be embedded, like the lower right lateral quadrant, mimicking acute appendicitis. This will help release that pressure and that trigger point. Do that for a few moments. To stretch the adductors, we're going to take our outer arm, put pressure, support the side of the leg here, interlock our fingers. We're going to swoop the heel of our hand into the muscle itself, swoop in, put pressure, and drop the leg out. Come back up, press down lower, and drop the leg out. Now as you get closer and closer to the groin, it's about to become very uncomfortable. So what you want to do is use their hand as a boundary. I can work that edge of the hand to support, and that way when I touch the back of the hand, it's not weird, it's not strange, right? So use their hand as a nice boundary, and I can work right up into the edge of that without causing any complications. Again, bring the leg back up, put pressure, and drop it all the way down. I usually start from vertical to about 45 degrees out. Once you've gone all the way up to pectineus, you can come back out, start at 45, and drop even further. And as you sit on the edge of the table, their toes are right under your hip. Don't sit way up on their foot. Just sit right at the edge of the toes and drop for your stretch. This next portion is going to be an active release with the leg rolling internally into pressure of your thumbs. They control the pressure. I'm going to put thumb over thumb, downward pressure, put pressure right into that muscle. She's going to roll her leg into it. Looks like this. Put pressure in, she rolls her leg towards me. Come down again, she rolls her leg into that pressure. And you want to have her hands again right there at the groin, and she rolls in again. And she controls how uncomfortable it is by how much pressure she applies. Working piriformis, we want to locate that first, and technically it's halfway down the sacrum, but if you add the coccyx to that, it's 1/3 the way down. But to find it, we don't want to poke around, we want to make it nice and quick. So we're going to press our fingers flatly against the border of sacrum. Just find the border, work yourself to the very top, come down to the bottom where it drops off, and 1/3 from the top. So if you divide that into 3 sections, the top third, center third, and bottom third, it's always 1/3 the way down. If I do cross fiber friction right there at the sacral border, nice and firm with fingerprints or my thumb, cross fiber friction, follow that down to cross fiber around greater trochanter, but don't put pressure on the muscle belly itself because you'll smack the sciatic nerve and it's not going to be comfortable, plus you might bruise the nerve. So cross fiber friction at origin and insertion. From here we want to do a slot machine. So we're essentially going to put pressure on the muscle belly, put the leg up, push the foot away from us, put pressure on the muscle belly, and then pull that leg towards us. Looks like this. Bring the leg up, put pressure right there, and pull back. We'll use our elbow as well as our fist, and make sure you put the pressure on only after you push the leg away first, and pull back. If you want to add some PNF to that, the client can go ahead and put pressure and push against your hand. You'll resist that. Hold that as she breathes. Relax. a little farther away, have her push again, and relax. Then go ahead and have her pull towards herself. Have her push against that pressure against your palm, and farther out, again, she's going to pull against your palm. Just adding some PNF work to that, muscle energy type techniques, and see if you can get some additional range of motion out of that. Bring your client to the end of the table, and we're going to have her on her side with her butt flush with the end of the table. And as she lays here, her glute medius and minimus are right on top, and we're just going to outline there to iliac crest, rear trochanter, and everywhere in between is going to be a trigger point. I'm using my thumb passively like a pebble. Just lay that thumb bone on top, use the heel of my hand and press downwardly for a trigger point release. It can be intense, especially if you're a dancer. If you want to add to that, you can use your elbow point. If you do, be careful. Use your hand as a controlling device and put pressure directly down and move around, holding that pressure, working with the breath. You're also going to add some cross fiber friction around greater trochanter, around the bone itself, as well as thumbs up under the lip of iliac crest. It's pretty intense. So find the top of it, come back about 2 inches and drop up under that lip and do cross fiber. Make sure you're watching your client's face because it will tell you a lot. If the pressure is too much. Now for pin and stretch, we'll have our client go ahead and put her hands and hold her lower leg in place. We'll pull the other upper leg horizontal to the floor. We're going to use the heel of our hand to come up under the lip of iliac crest. But we want to make sure enough pressure is on there so her hip does not rock and rotate. So bring the leg up, put pressure. We're going to drop that leg down for a stretch. Again, if you don't put enough pressure, the whole hip will start to rock, and that's not good for the low back. So bring it back up, put enough pressure, drop, and press down. If you want to use a horizontal elbow, you can. Keep it horizontal to the floor and drop that down. But your upper arm needs to come down at a 45-degree angle for enough pressure. Again, if they're a larger person, it's a lot of work for you. Have them do it actively. Bring that leg up on their own, put pressure, drop it back down. They lift it back up for you. Maybe using your elbow again. Drop it back down and come back up. All right, for the hip decompression, we're going to start off by just taking our hands into a loop, coming down right next to the hip, ASIS here, and just pull back. And the pressure should be back towards your own butt. Don't lift upwards, just pull back and hold. You can hold that for probably 30 seconds or so. Gentle decompression in the hip socket. From here, we're going to come into some work on the knee itself, and we'll be doing some cross fiber work. When you look at the knee coming together, it's like two fists. There's a line right here between the upper and lower leg, and just put your finger in that. It's halfway between the back of the knee and the front, and we'll just find that groove and work across that. And when you come across that ligament, if it hurts, you have a problem and you want to cross fiber friction it. Again, the inside and the outside both. Cross fiber friction in that groove where those two bones come together. From here, we'll bring the leg down. You do cross fiber friction on the patellar ligament above. Reinforce thumb, reinforce thumbs or fingerprints. I say fingerprints because I want to make sure you're using the pad, not the tip of your finger itself, above and below. Again, you use your thumbs if you'd like. Nice firm pressure, back and forth. From here, we're going to do some fascial work. You're going to grab the upper leg, grip it, and push away from yourself. And I call it a tug, but we're actually pushing away, and we're tugging those tissues away from the knee. We're not sliding at all. Just hold that pressure, stretching tissues up and away from the knee itself. You want to reposition, you can. Just grip it and push. And from here, we'll have our client scoot to the side of the table close to us. We're going to do a pin and stretch technique at this point. We're actually going to grip and put pressure on the quad and do a stretch up under the table. So to do that, we'll want to go ahead and bring the leg off the table. You'll have your knees to the groin. You're going to pivot into a lunge. Our upper arm is going to come between their leg and yours. I'm going to rest my elbow on my own leg. I'm cupping her leg. And I'm just going to put my arm on the inside on top of that leg as I rest and just lunge forward for a stretch. Release the pressure, come back, put pressure down, and stretch. Again, rest on your own leg, cup the leg, put pressure down, and lunge forward. From the same position, we're going to stretch the hamstrings. And we'll have them bring their leg up. We're going to sit on the top of the table and put it on your inside shoulder. I'm going to bring my inside arm and place my hand on my chest here, and that's just to keep the proper angle. I'm going to put the elbow point right behind your knee in the groove between the muscle bellies. And I'm going to support the leg here and just drag with no oil whatsoever down the hamstrings. After a couple passes, you're also going to have them do an active work. They lift their leg. And what I want to do here is I want to go ahead and drag only while she's lifting up. So we're going to lift her leg straight. I drag down. I pause. She drops her leg back down. I drag down again as she lifts. I pause. She drops back down. Continue along the way down the leg. If you start to just smooth the leg, there's no more point. Come closer to them and push it farther away, and that will increase the angle and get you a better sharp point between the muscle bellies. Again, lift back up. Now she's in a prone position. We'll go ahead and bring her leg into what I call a frog leg position here. Bring her leg out. We're going to start again with that tug where I'm just pushing the tissues, grabbing the leg and pushing it away from the knee, upward towards her hip, and just hold that to myofascial speed. No sliding, just grip the tissue and lift up. We also can take reinforced thumbs working across the IT band tissues. Put your thumb across those tissues, and whether you work from the front or back to front, doesn't matter. Just reinforce those, gliding across that band, broadening the tissues as you slide through them. Again, you can go from the top of the table if you'd like, working back across if that's easier, but make sure you reinforce your own thumbs. Very slow, nice broadening strokes. This next is also a decompression of the sacrum. It's a very, very gentle lift, and I want you to lift the knee up to 1 inch maximum. As we press down the sacrum using our hand, possibly our forearm, the pressure is to keep the low back down, and we're simply going to lift the knee straight towards the ceiling. So I often just put my hand fully on the sacrum and just, as the leg is bent, lift up a bit. My force down is equal to my force up. A very, very gentle stretch in the hip and groin. From here, we're also going to stretch out the quads some more. And versus just pushing the foot down, we're going to lift the knee up, place our knee under theirs. It really enhances that stretch as you press the heel back towards your glutes. Nice and slow. So from here, we can stretch out the psoas as well. And we're just going to put our hip right into her low back. And we're going to lift the leg up, support right above her knee, right at the ankle, and just wrap it around ourselves and use our hip to support and keep that low back stable. And just use your hip as that pressure, keep the leg parallel to the floor, and hold it for a few moments. When you get done with that, bring the leg back. And we're going to take the bottom leg and keep it nice and straight for ourselves. And we're going to use our fists and come straight down into both the front and back and center lines. So we're going to have our fist coming down on the hamstring line, adductor line, and quad line. It's just like this. Support, put pressure straight down, hold that. I can roll a bit back off of the hamstrings. Put pressure down, roll backward. Put pressure down, roll backward, hold that. Come back up, put pressure on adductors, straight down. Straightforward compression. It's not a gliding technique, it's a straight compression work. When you hit the knee bone area, don't press on those. Again, towards the front of the leg, in the quads, pressing straight down. On the TFL, I'll go ahead and rest her leg in my arm. My hand cups her knee, and bring her knee to the table, her foot up. Put pressure on the TFL right below ASIS. Press it in, and then straighten her leg out. Again, knee down, foot up, pressure in, and straighten the leg. If they're larger, your hands are smaller, have them come forward, keep the knee down and foot up. We'll put hand over hand, reinforce that, put pressure on the muscle, and she'll straighten the leg out. Great. Come back, do it again, foot up. Perfect. Put pressure and straighten that back out. Awesome. To work the sacrum and pubic symphysis release section, we're going to put our heel of our hand on sacrum, other hand comes across, and all our work is just pushing the two apart, pushing sacrum down towards her feet, pushing the skin and fascia in the center of her mid-back up towards her head, and just holding that pressure, pushing the two apart. It takes some strength. Just hold that pressure for a bit and just wait. Small decompression to start with. From here, we're going to start doing some cross fiber friction at sacral borders. You either can do it thumb over thumb on your side of the table or reaching across, reinforce fingertips on the opposite side, and just do cross fiber friction, working the entire border up and down. Whereas before with piriformis, we were very specific. This section here, we're working the entire border from the top of the sacrum all the way down towards the edge of the coccyx. Nice and firm, not too fast, but be firm with your pressure. If I take my hand and I grip the outer borders at the very, very top of sacrum, if your hands are small, you may have to use two hands for that, but as you grab the edges of that border, you'll find it drops over the edge on both sides. As it drops down, what your fingers and thumb are dropping into is the SI joint. So at the very, very top of sacrum, you grip it. As it drops over the edge, you now have your finger in the SI joint. It's usually approximately from the head to toe. It's going to vary at angle. Each person's slightly different, but find that groove and do cross fiber friction. You'll be in that groove. You'll be on the ligament itself. And the SI ligament is often injured in accidents of various types. But we're just going to cause some synovial reaction, get some cross fiber friction to release scar tissue and such. Just work that on both sides, nice and firm, for up to a minute or so at most. After cross fiber friction, we're going to get on top of the table. And we're going to put the heels of our hands on the SI joints, pressing straight down, arms are floor to ceiling. After a minute of compression, I'm going to press down on one side while lifting the other side up. About a dozen times left and a dozen times right, pressing down while lifting alternately. If they're very bony, you may want to put some sheets or something on the front so they don't hurt as you compress against that ASIS on the front side. Again, after a dozen lifts per side, we'll turn them over and have them lay on their back. Do the exact same thing again with their knees bent this time. Come back up, and we're going to press straight down on the ASISs. If they have long legs, just pull the legs apart slightly, press straight down. And after a minute, same thing. Push down one side while lifting the other. And lastly on this, we're going to bring her knees back up. And we're going to start off with having her push her knees apart. We're going to put our arms into a loop and have her just push her knees apart. We're going to hold that and resist it. So we're going to do that, push. And start with her feet together. And after a few moments, we're going to separate her feet more. Have her do it again. She's going to push apart and resist. If that hits you in the breast, just turn yourself to the side a bit. Do it again. Now the opposite, there's two ways to do it. She can bring her knees together with cross arms. So we're going to have her put her legs apart, put cross arms, and have her just push together. And I do this so that she's not hurting herself with my elbow point. You also can hold the two apart and just support and have her push together. But do not put your elbow between the two because that bone will start to hurt her where it connects. So just hold those two together and have her press. For bicipital tendonitis, the most difficult part is actually locating the tendons. So we're going to take our fingers and hook the armpit, and she's just going to rest her arm on the side, hook the armpit, come lateral about an inch, and do cross fiber friction at that point. This is a musculotendinous junction of the short head of the bicep. Hook that, come lateral, cross fiber friction. If they have a long head issue, same idea, come on the side and cross fiber friction where it hurts. The supraspinatus tendon. I'm going to bring her arm behind her back, and she's going to hold that there in place for me. As she pushes that behind her, it reveals the tendon. So you're going to find the most lateral point of the AC joint. Put your thumb on, or your finger on top of that. You'll have bone, bone, bone. There'll be a lip, and as you find that underside of the lip, come around the front, usually between 3/4 of an inch or an inch or so, you'll find a vertical tendon, and most of the books show it wider and larger than it really is. It's like the size of a pencil at most. Come on the front of that, and you find that vertical tendon, just cross fiber friction that, and on both of these, you'll follow with ice massage, and make sure you dry it as you work so you're not having water run down the arm. Very simple again, most lateral point, follow that groove around the front, you'll find the vertical tendon, and your cross fiber friction that. And it's going to be very uncomfortable. If they need to have this done, it's going to hurt. When working the low back for the QL and psoas release, start with your patient or client laying face down, and we're going to take the side of the body that hurts least first. And what you want to do is just go ahead and find the upper iliac crest and the lower floating ribs. And as you palpate and find those ribs, oftentimes when someone has low back pain, those lower ribs are pulled down so far they're almost touching the iliac crest. So when the person leans side to side, they feel a sharp pinch. And that's actually the rib touching iliac crest. So find that space between the two. Follow that space up to the spinous processes. You'll find next to the spinous processes a ditch, the laminar groove. Next to that, right next to it, is the muscle belly. With horizontal thumbs, thumb over thumb, catch the edge of that belly. Press down at a 45-degree angle and just put some pressure on that for a bit. Just massage it and see if there's any sharp pain. If there's sharp shooting pain, we're not going to do the next step, which is a movement. So put the pressure in here, hold that pressure down, some cross fiber friction. Now we're going to do an active motion where she's going to flex and extend her lower trunk here. So to do that, we're going to have our client practice first by pushing her butt up in the air and then butt down and low back up. That's the movement we're going to have her make, but the trick is we're going to have her pressure on that as she does it. So put your thumb over thumb again. At that same point, put pressure down under that lip at a 45-degree angle, and she's going to go up and down under that pressure. So go back and forth for me. Up. Great. Nice and slow. This is not how many, it's how long. So I'm going to have her do this for about a minute. That's all you need. And holding that pressure. Now, over time, this might blow out your thumb. So I'll have her pause for a moment. I can use my olecranon, use my elbow point, hook up under that edge again, keep your arm straight to the ceiling. If I drop it forward, I'm smashing the muscle. I want to do that. I'm going to hook it, have her go up and down, and I'm going to follow her. When she goes up, I go up. When she goes down, I go down, but the pressure forward is constant. Again, she goes up, I go up, she goes down, I go down. And we'll have her pause after about a minute. Then I'll repeat the exact same thing on the other side of the table. After I've done that, I'll turn her over. So go ahead and turn over for me. Have her keep her knees bent. And we'll repeat this again, starting on the exact same side of the table as you started. So that way we're working on the opposite psoas to start. So you'll find the ASIS and lower floating ribs, and we'll find the midpoint. Do not use their belly button for a landmark. That seems to change over time. But find the midpoint between the ASIS and the ribs at that spot, and go from the center of the body, from her linea alba, the center of her body, to her side. Find that rough intersection. I'm going to take my fingertips and come down with fingerprints and press down against that. So I have the spine, and I have the psoas next to it. If I come at that exact spot, I will press the psoas into the backboard of the spine. So at that point, I drop in, use my fingerprints. As she exhales, I drop in. When she breathes in, I come back out. By the third breath, I should be on top of psoas. And again, it's about the size of the person's wrist. It's very large. Breathe in last time. If she drops in, I'm going to pin that down to the table. Very firm. Hold that pressure. Now a slow, slow abdominal breath. Nice and deep. Deep breath for me. Resist that pressure and let go. Give her a free breath. When you press down on psoas, you will press so hard they cannot push your hands up. So as they breathe in deeper, you press harder. Do not allow them to push you up. When we're on the back side, on the QL, you do want to rise and fall with their breathing. On this side, you do not. So we're putting pressure on psoas. As she breathes in, the diaphragm interaction is causing that release. Again, nice deep breath for me. When she exhales, I drop down. I pin it down to the table at a 45-degree angle. Nice deep breath, and I resist that. She breathes in and release. About 6 times is all you need. 5 to 6 typically is enough for a release. The very last one, have her breathe in on the 6th one. When she exhales, we'll drop down. I'm going to pin it, slow deep breath. At the very top, she's going to hold it. So nice deep breath, breathe in, nice and deep. Hold it for about 5 seconds, and then release. Again, repeat on the opposite side. When they're done, very slowly bring them up off the table, hold their arm, have them walk around the room, make sure they're able to do so without passing out or falling down. But take your time with that and just let them walk around and feel that change, which is going to be immediate. Working the shin, we'll start off just by pressing her foot into the table, bringing her foot into internal rotation of the leg. Brings the tibialis anterior to the top. Don't use any lotion at all. If it's super, super dry and you can't even move, maybe a drop or two, but just push your fist right in, keeping your arm at a 45-degree angle in front of you. Nice hard fist. Do not use a soft fist to hurt your joints too much. Just press that ahead of you, nice and slow, in the center line of the muscle belly. Nice and smooth. You're also going to use your fingers pointed up and thumbs pointed down, press right into the muscle belly itself. And we're going to put pressure in while she takes her foot and comes up and down and flexes and extends the ankle. Looks like this. I'm going to put pressure directly in. And she's going to come up and down with her foot. And back down. Have her pause. We're going to move ½ inch. Have her come up and down again. Pause. Move up again. Again, you want to have a nice lunge directly into the foot. So you have good body mechanics for yourself. And work all the way up. Be aware that the top third of the muscle is more tender than the rest of the muscle, so it will get more intense for them as you move. We're pressing that muscle directly back into the bone, allowing it to start to heal after shin splints. Again, she comes up, back down, have her pause. We're going to move up and down, and pause. Next, we're going to work between the tendons of the foot. Use the edge of your thumb, working our fingertips between the tendons, working up towards the ankle. It's not super imperative to keep that same direction moving, but in general, we're trying to work up towards the ankle. Cross fiber friction between those tendons. After you get to the top of the ankle, we're going to take and do a pin and stretch of the entire tendon with the toes as a group. But I'll use one tendon at a time. So I'm going to bring the toes up as a group, put thumb pressure on top of the tendon, and bring those down as a group. Come back up, shorten them, put pressure on top of the tendon, and back down. Come back up, shorten, pressure, and back down. Don't just do one toe at a time. We'll go ahead and do this as a group. It's so much easier. And working all the way up towards the ankle. This should feel good. From here, before she turns over, we'll do work around the malleolus. Reinforced fingertip work. Again, the foot is very complex, but it's amazing how simple work on these retinaculums and such as we work around here, it really helps ignite that process of giving synovial reaction and breaking up scar tissue and helping lubricate those straps and giving health back to the foot. So a lot of folks just love the bottom of their feet work, but the top is very, very important for that function. From here, we're going to go ahead and take our thumb reinforced and slide down from the bottom of the heel, sliding down the arch of the foot towards the toes. Thumb over thumb or thumb beside thumb. Just slide down, working the inside, the center line, and the outside angles all the way down. From here, we're going to also do a swoop, so to speak. I kind of joke in class that I'm serving cheese on a platter, and I start with my arm perpendicular to the foot. The elbow is just below the calcaneus bone. As I slide down the arch and come towards the toes, my arm is going to become parallel to the foot. So same angle as the foot. Don't lift your elbow point up. Same angle. I'm going to start just below the calcaneus bone. I'm perpendicular. My outside arm is supporting the foot. My inside arm is doing the work. elbow point just below calcaneus. I'm supporting the foot here, and the toes are flush with the end of the table. I slide down. As I slide down, I'm spinning my arm into perpendicular angle with the foot. Again, don't make a sharp point. Slide down, and this should feel great. But you have to do both simultaneously to make it work properly. Additional tools to help you out with stretching out the calf you might want to add to your techniques. A lot of folks kind of work the calf like this. It's very hard in the shoulder. I'm going to go ahead and put my heel of my hand right on her heel. The foot's right on my forearm, and just grab and just lean. Very simple. I can grab the calf with my hand if I want, stretch. I can lean on here if I want additional pressure. That saves myself and doesn't hurt my body as I'm trying to do a stretch. If you want to enhance that even further, you can bring the foot off the edge of the table, put it into your ASIS here right below your TFL, put pressure on the calf, and just lunge forward as I work. Nice stretch. Just make sure you turn the foot enough that the heel is not hitting your own body, or come back into a further lunge to keep that heel from stopping when it hits you. So just put pressure and lunge. Working the upper back, we're going to start with some myofascial tug. Bring your forearm, upper shoulder muscle here in trapezius. Put pressure down, no oil, and just tug those tissues and hold them. Hold that pressure, reposition if you want to, but no sliding. Just hold the tissue for a tug. This position is also great for working posterior cervicals. We can actually put pressure, finger over finger, working the back of the neck, support those muscles, using the face cradle for support, also into the occiput, and reinforcing our fingers at the same time. Working the laminate groove also, reinforce your fingers, work up and down. You'll find these small little muscles, the intrinsic muscles, which have an effect on the bones of the spine. Just cross fiber friction, working that entire ditch on both sides of the neck. Next, we want to do a stretch on rhomboid. Bring the arm on the low back. If it hurts to do that, keep it alongside the body. But reach across the table and grab a center bicep, not the shoulder, not the elbow. Grab that, bring the shoulder girdle up and glide out on the rhomboid using your thumb or your heel of hand. Pectoralis minor runs from the coracoid process down the pec. 2 fingers wide, 3 fingers of muscle. We're going to do some local pin and stretch work where I just actually locally, fascially stretch those 2 apart. From there, I go right into a trigger point work where I put pressure. And if I want to make sure that her breast is not in the way or I'm not touching the breast, I'll use her hand and use that to pull the breast aside and put trigger point pressure on. Lastly, on the pectoralis minor, if I reach across and want to do a stretch, I can have her hold herself and protect. I put the arm over the neck. I put my fist right on pectoralis minor, press straight down, and pull the arm up over the head. Again, arm straight up, press down with my fist, and lift up and over. Working on the teres minor, we're going to work the borders of scapula, putting pressure right against those trigger points. And just take the side you're closest to, put pressure along the borders, work all the way along, and put pressure right into those trigger points. You also can hold those trigger points and do a pin and stretch with bringing that arm up alongside the head. Infraspinatus is the lower aspect, the lower borders of scapula, spine of scapula. 1 inch in, everywhere you push is going to be trigger points. And the harder you push, the farther that trigger point travels, typically up over the shoulder, down the arm, into the back of the hand. Just put pressure on those. You also might find some people have infraspinatus tendonitis, which is right at the crease of the armpit. We're going to roll over that tendon to cross fiber friction, followed by some ice if necessary. And if they have the problem with it, it will definitely hurt. Cross fiber friction really firmly on that for about 30 seconds. On subscapularis, the most important thing is to get your mind around the idea that the side of the breast for most women does not feel like breast tissue. A lot of folks try to go up under the scapula right at the edge and force through those tissues and cause a lot of pain. But if you can come along the side of the breast, ask the person if that feels like tissue. They typically say no, it does not. And so if you come along the side with lots of oil, you're able to slide along the side of the breast, come up into the axilla, keep sliding with lots of oil over and over, and come up under the axilla. You're able to get right into the muscle itself and subscap and just press straight into those trigger points. There's trigger points a third from the bottom and a third from the top. On my side, scoop up under, press into those and hold them. The upper trigger points, you might vibrate that some. But also, if that does not work for frozen shoulder, we'll use a PNF where we're actually going to put pressure against that arm. The arm stuck on the side of the body. We're going to press in. We're going to hold it. We're going to press the arm against us and push away. And abduct, abduct. Twice. We'll pull a bit. Have her push away again. Again, you'll pull the slack. Have her pull towards herself and adduct. Relax. Pull again. Have her adduct. And keep doing that. Once you get to 90 degrees, you've actually succeeded in breaking that frozen shoulder. Above that, it's not really involved, but the first 90 degrees is very important. When working the posterior neck, we're going to start off with just a start with a myofascial tug, and just hold the tissues and pull, and just wait. If they're in an acute phase, or if there's any issues in the neck that would cause a sharp pain from doing this, well, don't do it. Otherwise, we'll start off with just a gentle myofascial tug. Alternate your hands. Most of you already do work where you're working trigger points in the back of the neck, posterior cervicals. We'll continue with that. And as you work yourself into the occipital ridge, let the head just fall back on your fingertips and relax. And give you a way to enhance that. And we're going to go ahead and put pressure into the trigger points in the back of the neck. So if I put pressure on the right lateral aspect of that ridge and lock that in, lift the head up into the left for a stretch. You should feel a tug right to your fingertip. If you can't feel much of a stretch, tilt the head back into extension. Again, lock that trigger point in or spasm in. Lift the head up in the opposite direction. But it should be so much tension that you cannot lift the head very far. If the chin is touching your chest, you're probably not putting enough pressure on that. So again, work yourself across the ridge. If I find a tight spot on the left side, I'll lock that in, lift the head up into the right. At this point, we'll have you scooch to the side of the table at your most dominant. So if you're left-handed, you go left. If you're right-handed, you go right. For the sake of the video, I'm going to go to the left so you can see. Put my left arm under her neck and just rest that arm at her occiput. And I push down on her forehead firmly enough that when I slide my arm into the occiput, I can't go any further. And press down hard enough that as I turn my arm, it can't go anywhere. So I'm going to make a nice fist and just start to turn that into her occiput. If you go any further than just 90 degrees of turn, you didn't press down hard enough. But as I press down on her head and turn my arm, you'll see that compression goes against her occiput and I decompress her neck. And as I take time to get into that stretched state, I'm also going to take time to decompress slowly and let that pressure back off. So again, you start palm up, and I'm going to go up until my hand is at maybe 90 degrees of turn. But if I go farther than that, I didn't push down hard enough. So I push the head down, make a fist, pull into the occiput, and start that turning for traction and decompression of the spine. This next is a cross-arm technique for PNF, and we're just going to go ahead and lift the head up and put one hand up, put pressure on the shoulder, other arm comes up and under, and I'm going to put my arms down on the table, and she's just going to press back against my arms. Take a nice deep breath. As she presses back, and then she's going to exhale and relax. I'm going to lift up a little bit. She's going to press back again. Nice deep breath. And exhale. A little longer next time. She's going to push back. Nice deep breath and hold it. And then relax. I'll lift up a little higher. All the way up until you get to about 90 degrees. Push back. Nice deep breath. If you go slowly, you can get quite a bit of range of motion out of this. Again. When you get to the top, have her relax. And we'll just hold the head there. Just massage along the posterior neck. Just massaging the skin over those bones and give it a chance to relax. Great. Bring your head back down to the table. This next is a testing of the scalings, and we're going to be able to do some specific understanding of which muscles are involved, if there was an accident or an MVA of some sort. And we're going to start off by taking her head and put the right hand under her head, rest it on the table, and bring her left ear to her left shoulder. Pause for a moment, a little bit further. And if you find that their shoulder starts to come up, take the pressure off and have them tuck their right hand under their butt, palm down. So go ahead and rest it under there. That keeps the shoulder locked down. Again, continue on, left ear, left shoulder. When you go as far as you can, just roll the head the rest of the way to the left. My other hand comes across in this triangle of the neck here, triangle on the sides, along the clavicle in the back, the soft spot. We're going to put pressure here, and I'm having her look behind her, so we're testing posterior, putting fingertips straight down towards the ceiling, nice and broad. Press the head towards the left. My finger pressure is going to go towards her right, and I ask her if that hurts. And if it does hurt, go back the pressure off. It'll do small pins and stretches with small cross fiber friction. So I cross fiber, gentle pin and stretch, gentle pin and stretch, cross fiber friction, gentle pin and stretch. Now, nose to the ceiling, left ear towards her left shoulder. Take the slack up here. My fingers go in the center of that triangle. I put pressure nice and broadly. My fingers go to the right. I push your head to the left. Push the two apart, and you'll ask if that hurts. If it does, you'll back the pressure off, and you'll feel that muscle pop up, the middle scaling. Do cross fiber friction on it. Small pins and stretches. So that tests and treats the middle scaling. The anterior scaling, we're just going to go ahead and have her head turn to the right. Even though her left ear is towards her left shoulder, she's now looking towards the right. And we're going to put pressure in the anterior part of that triangle, right on top of the anterior scaling. I push my fingers towards the right, her head to the left, and ask if that hurts. If it does, she's testing positive for whiplash, essentially. I don't want to tell her that because I can't diagnose. But I would back the pressure off, do small cross fiber friction, small pins and stretches. You repeat the other side. You'll switch hands, pause for a moment, and you'll start to bring the right ear to the right shoulder, and she'll tuck her left hand under her left butt to hold that shoulder down as you move. So repeat it on the opposite side. Again, looking to her, behind her is posterior, nose straight up is medial, looking to the opposite side is going to be the anterior scaling. That's how you test it, and that's how you treat it. Lastly, we're going to do a sternocleidomastoid or SCM stretch, and it's kind of a teeter-totter. So I'm going to start by putting my hands on the side of her head. I'm going to turn her head to the side. I'm lifting or turning the head so far that if she were to help me, her SCM goes between my nose and her toes. So you want to turn the head that far. Lift the head up, and your lower fingers are going to point towards her toes, not to the side, but straight down. I support below her neck. Top hand comes on. I'm going to pin the SCM right to her mastoid process and lock it in. As I drop the head back, I'm going to push up from below on her bones of her neck and make a teeter-totter and stretch that for a stretch. If I drop my lower fingers, she loses that fulcrum and there's no more stretch. So again, I lift the head up, I pull the SCM as she drops her head back into my hands. I pull the SCM into the mastoid bone, push up from below, and drop the head back for a stretch. If the head's too big or you're not strong enough, you also can use your forearm. So since I'm using my left hand, for example, on her left side, I would again turn the head so far that her SCM runs from my nose to her toes. I lift the head up. She drops her head back into my hand. The pressure comes off. As it drops back in, just overhead, I pin that muscle, push out from below. But if that hurts, I can put the same arm under the neck as well. So right now I'm using my left hand under. I could also use my left forearm. So I'll use my fingers as a fulcrum. I'll balance her head, I'll lock it, and pull her head over my forearm for a stretch. So I put pressure on my thumb. This is supine number 2. And we're spreading outwardly on that center line of the Galea aponeurotica. From here, we're going to take the temporalis and just rake through it and pull up towards the top of the head and just gently glide through the hair towards the top of the head. Once you've done that, We'll come back and do it again, but this time she's going to open her jaw gently against my pressure. And then we'll pause, have her close her mouth. We'll do it again. She'll open her jaw. We'll pause, she'll close, do it again, open. Great. At this point, we'll go ahead and do a platysma stretch. And we're just going to have our fingers hold nice and broad and stretch the platysma. Platysma is a very, very thin muscle. It's almost like just fascia, but it is a muscle. And superficially, we'll stretch that out. From here, we're going to do a masseter glide just below the cheekbone. A zygomatic arch, just fingertips going straight down from the top towards the table. We're hooking just below it and going straight down. You also can stretch the muscle out by hooking that masseter with your thumbs on both sides and just push straight down toward the table for a stretch. Back the pressure way off. Press gently and have her open her jaw against your pressure. Pressure comes off, closes her mouth, do it again. If you press too hard, she won't be able to open her jaw at all. Great. Imagining if we have a finger right here, that's a condyle of the mandible. We're going to massage around the back of that condyle. You'll feel a round protuberance. Massage around the back side. And if they have TMJ issues, this might be very tender. Massage around it. Also grab the back side of that condyle just inside the ear. Different angle for you. If I take the front of the cheekbone and the back, I have that border right here, just halfway between the front and back. I'm going to take my finger at that midway point just below the cheekbone and press straight in with firm, firm pressure. As I go through the masseter into that deeper muscle, it's the medial pterygoid muscle deep beneath, I press straight in with extreme pressure. You'll feel that. It's very, very tender, but press straight in. Afterwards, we're going to catch the lateral pterygoid muscle on the outside, and you'll find the ramus, that sharp angle here of the jaw. As you follow that back, you'll feel that bending point. We're going to hook up and under that ramus, hook up and go up and out, hooking that. And of course, again, very, very tender as I reach up under that. Some small cross fiber friction. My fingers now come up under the jaw, and we're going to spread the mylohyoid, the floor of the mouth, from outside, just pulling towards yourself. Pull up under and broaden that side to side. Especially being cold and flu season, they might have some glands that are swollen, so don't pinch those against the mandible. Just reach up under. Glide the lateral, and as you approach the edges of the mandible, just back the pressure off so you don't actually squeeze those nodes. The infrahyoids, we're going to hold the trachea in place on one side and massage along the border of that trachea on the other side. Just massage along that. Nice firm pressure. But I'm holding that in place on one side while massaging on the opposite side. And then repeat. To work the longest capitis and longest coli, which are the muscles that affect the military neck and keep the neck from allowing it to have a proper angle, is we're going to go ahead and stand alongside the table, put our hands on the side of the trachea, and she can balance the heel of one foot on top of the toes of the other and help disengage the gag reflex if she needs to. She also can grab my wrist gently to be in control. If she wants me to back off, all she has to do is tug it out. But I come in here, I put pressure on the side of the trachea, pull it towards myself once, release, towards myself a second time. By the third time, that deviates quite far. My fingers should be almost in the midline of her chin. I'm going to drop straight down, and for lack of a better term, I'm going to bless the neck. I'm going to go up and down and side to side with fiber and cross fiber. Pull towards myself, drop straight down towards that wall, firmly go up and down and side to side. Depends how long her neck is, but one or two spots is typical. Up and down and side to side. Excellent. So the intraoral sequence, we're going to start by putting our fingerprint on the inside upper lip and just press up on both sides. See maxilla fascia, just hold that gently. And then work on the other side as well. Again, as long as your fingerprint is pressing broadly, you're fine. Don't use a finger point. When you're done, work the mandible fascia here. We'll press down the lower lip, between the lip and the teeth, pressing straight down. Hold that for a stretch. And do both sides. Nice and flat. This next one, we're going to work from one side of the table. We're going to take our hand and we're going to put our finger just inside the lips, have her close her mouth and slide along the upper teeth to the very back until you hit a wall. When you hit that wall, we're going to hook up and in and do very gentle, small circles. This is going to be uncomfortable if they have TMJ issues. After you work the outside upper teeth, we're going to work and come along the outside and put back of my finger pressure against that cheek and keep going backward and backward. We're outside the bone of the jaw. We're going to catch a web. It's actually a ligament. We're going to press against that and just put pressure down for a gentle stretch. And just hold that. Again, from the same side of the table, we're going to reach our fingers just inside the teeth, along the inside lower teeth between the tongue and the floor of the mouth. Follow the roots along to the very, very back. Hook up and outwardly. And do gentle, small circles. If they have TMJ issues, this will be the most uncomfortable part of the mouth typically. Those center three, you'll repeat again on the opposite side of the table. Outside upper, outside cheek into that catcher's mitt, so to speak, and then the inside lower. But from here, we're going to go ahead and do a trampoline just inside the floor of the mouth, under the tongue, pressing down. And then meet that pressure with your finger outside the chin. And do the top and bottom of that trampoline floor, stretching up and down both sides of the mouth. Working up and down. And the last piece of this is going to be a flat finger set pressure on the roof of the mouth. Is hard. And as you work towards the back, you'll feel a velvet ridge. When you hit that velvet, you're just going to press gently straight up towards the top of the head. It's a palatine fascia. And you don't want to press very hard. It's a very, very gentle pressure. Great. And then we would repeat that on the opposite side of the table. Again, the outside upper teeth, outside cheek into that catcher's mitt, and then the lower teeth under the tongue on your side of the table as you reach under those lower teeth. Well, thank you very much for joining us with Secrets of Deep Tissue and this technique DVD. I hope it's a big help for you to watch the techniques over and over again. And I look forward to seeing you again in the future. Thanks so much.